Hey everyone, Lisa Chase here with Back to Normal, and it is May. Can't believe we are literally almost halfway through the year. But this month we are talking about how to keep our joints and our bones healthy. And in order to do that, I'm sure it is no surprise, we need to exercise. As a physical therapist, I counsel people all day long on exercise. And probably the biggest thing I hear, and I'm sure that you can relate to this, is I just don't have time, right? Oftentimes people don't have time to exercise. They may have pain, and that limits them from exercising. Or in order for them to get a really good effect, they have to do high intensity training, but they don't tolerate doing high intensity training. And then sometimes people just aren't motivated, right? I too can struggle with this. Let me tell you, a couple years ago, I was diagnosed with arthritis in my thumbs. I use my hands a lot as a physical therapist. And I had a bone density test, and I was told that I had beginning stages of osteopenia, which is where the bones start to weaken and could lead to osteoporosis. So this was a wake-up call for me. And I really, said, okay, look, I really need to exercise much more than I am. And in order to build bone, you need to lift weights. And you need to lift weights that have enough of a load that load the bone, right? So it was really hard for me to do that because to lift heavy weights, it really, really hurt. So I have been looking for different strategies, and one of the strategies that you may have heard me talk about already is I go to Osteostrong. So this is a place where they have very specific machines that allows you to load your muscles, and your bones in a way that helps to improve your bone health. So I have been doing that. And then recently, I would say reintroduced. I've known this technology has been out there for quite a long time, but I really didn't understand it. I hadn't had the time to really research it. Many of my colleagues are using it. And so it is a technology that when used and paired with exercise, listen to this statistic now, it will help you to decrease the time you have to exercise and decrease the weight that you have to use when you're exercising. So this was very interesting to me. And the other thing that's really cool is when you use this technology, that post muscle soreness that you get, you don't get it that much when you use this technology. So that is good. And also you're just generally, you don't have pain. You're not having to do that high intensity training. So you can use less weight and get better results. Okay. The other thing that's really cool is that it increases your growth hormone. So growth hormones decrease as we age, and they're very important. I don't know if you're like me, but have you noticed as you get a little bit older that it's harder to lose weight? Well, in part, that's because of lack of growth hormone. Well, in order to get a surge of growth hormone, you have to do high intensity training. Well, again, some just don't tolerate high intensity training or might not have time to do high intensity training. So this technology has shown to increase your growth hormone by 25 times greater than if you exercise without the technology. So this absolutely got my attention. So you're asking, well, what is this technology? So this technique is actually been around for a long time. And it is called blood flow restriction training, okay? And let me show you what exactly it is. So it is these straps that you put around your arms and your legs. So I'm just gonna show you how I do this. If I can get that strap in there. All right. Super easy, I should say. Ha! Got it. Okay. All right. So they are straps that you put around your arms So it goes on both sides and around your legs. And then what you do, there are numbers on the side that tell you exactly how much to pump this up to. All right, so this snaps in, and then I look at my number, I go pump it up, then I remove. So I would put all of my bands on, and then I would simply exercise for 20 minutes using a light resistance band, okay? So what this does is, this is gonna slow down the blood flow to my arms and my legs, and it's going to make my muscle get deprived of oxygen faster, which is what happens when you exercise high intensity wise, and your muscle will fatigue faster. And then as my muscle fatigues faster, that means I don't have to exercise as long. So basically what I do is I get the straps on. This morning, actually, I put them on and I took, Mr. Buster Brown, him and I went for a nice power walk, and then I came back and I did just a few quick exercises to complement what I did with my, my cardio training. And I did some stretches, and within 20 minutes, 25 minutes, I was done. So I love it. It's great. So we just started using these with our patients, and we're really getting a great result. I'm starting to use it myself. I will keep you posted. I'll let you know how I'm doing on my training. But what are you doing to exercise? What are you doing to keep yourself motivated, to keep yourself moving, healthy, and strong? We'd love to hear from you. All right, until next month, you guys keep moving.